rectum, and if there is any mass they can feel, any mass is growing inside the prostate gland, they will be extended onto the rectum, right? So if anybody insert the finger into the rectum and they can palpate, they can feel a mass, and they can characterize the mass. Is it a soft mass or a hard mass? Is it a smooth surface or irregular surface? It is a painful or non-painful? If the wall of the rectum is invaded by the mass or not, they can pull out the finger and they can see is there any bleeding or not. That's why before rectal sonography for the prostate gland, digital rectal examination is must. DRE. Digital rectal examination is a must. Why? Because there might be a contraindication of rectal ultrasonography. Contraindication of digital rectal examination. Why? Take the history. If patient says, no, I have too much pain, I have a painful anal fissure. If there is a bleeding polyp means it bleeds on touch. If there is a mass, bleeding mass, if there is an abscess, you cannot do the rectal examination. It's contraindicated. If patient says, no, I don't want that, so you cannot. Okay? So that is very important. And you need to know the zones. Okay, so I gave you. Now I will draw another diagram. It's that another diagram. That is this is coronal view. Then to understand the zone, and I'm going to draw the axial view. So this is transitional zone, this is fibromuscular zone, and this is peripheral zone, and this is central zone. This is urethra. This is ejaculatory duct. This is surgical capsule. Because surgical capsule helps the surgeon to understand which zone is it. And this is seminal vesicle. So this is sagittal view. Okay, this is verumontanum, this area. Okay, here I'm going to, I forgot to show you. So prostate gland, if you see, so you will see the prostate gland like that, and you will see a center hypoechoic layer, that is urethra, and then you will see the zone. So you just need to be a little used to understand the where is the peripheral zone. Peripheral zone, definitely this would be peripheral zone. Close to the urethra, that will be transitional zone, and this will be central zone. And if you see the dark area here, triangular shape, that is verumontanum. And verumontanum is the site where the ejaculatory duct joins with the urethra. Okay, so
Can you put this picture?
yeah, of course. Okay, now if somebody has prostate gland problem, the most common is BPH, benign prostatic hyperplasia. Beside this, there is another disease called prostatism or prostatitis. Prostatism and prostatitis, you may not need any treatment. A little touch or trauma onto the prostate gland can cause prostatism. Then what is prostatism? And it is the symptoms same as prostatitis. What is the symptom? Patient will feel like frequency increased. Small amount of urine formation. Patient will go to the bathroom, there is a lot of hesitancy to start the stream. It takes time, 2-3 minutes, then it's coming. Then when it comes, then thin stream. Or drop by drop. Bladder is contracting, but the neck is not, gate is not opening. So then, if you want to stop, too painful. You cannot stop. And usually it takes 2 minutes to complete the whole thing. Now it's taking 20 minutes. Sometimes there is an infection, burning sensation. Okay? Patient may come with cystitis along with the prostate enlargement and retention of the urine. You will see the bladder wall is so thick because it's contracting, exerting too much pressure to release the urine, but it's not coming out. Patient will have sleepless night. In the daytime, drowsy. Why you are falling in sleep in the daytime? No, night time I have to wake up 3, 4, 5 times to go to the bathroom. I cannot sleep. Okay? And it's after 50, after 60, 70, 80. So life is miserable. No good life. And that is prostatism, prostatitis, and the BPH. All are same symptoms. Prostatism and prostatitis, most of the time they don't need any antibiotic, but they might need antibiotic. Antibiotic can cure the problem. But they can have the prostatic massage. What is prostatic massage? With the finger. Through the rectum, feel the prostate gland, and with the gloves and massage. It gives the soothing effect, it gives the relaxation of the muscle part of the gland. Patient feels soothing effect. Otherwise it's very cramping pain, dull pain, annoying pain. Okay, so it's not good. Sometimes there's an abscess in the prostate gland. If that infection happens but it's not cured, and the source of infection is always there, so then what happens? It may turn into abscess to the prostate gland. If there's an abscess in the prostate gland, now temperature is very high, very painful. Patient cannot sit, patient cannot sleep, patient cannot walk. Very painful. And the patient is really very sick and patient needs antibiotic. Sometimes patient might need surgery to get the pus out. Otherwise antibiotic may not work. WBC count will be very high. Okay? So then question, when there is a cancer, when there is a malignancy, most of the time it is asymptomatic. And cancer happens mostly on the peripheral zone, right? When there is a peripheral zone, look at here. I drew already the border of the malignancy, irregular, right? And if it extends this way, then what's going to happen the border of the prostate gland? Irregular or regular? Irregular. So if this is the extension of the malignancy, right? So in this view, what you see, the regular outer border, right? So then what you're going to see here, if there's a mass in the peripheral zone? Then you will see the borders are irregular, something is pushing the outer wall, and it is hypoechoic, sometimes heterogeneous. Then you will say, oh, I got it. So that is malignancy. But most of the time it is asymptomatic. And prostate gland can be evaluated transvesical and transrectal. Transvesical means transabdominal, right? Okay, with a full bladder, fine. But the problem is, in transabdominal, the symphysis pubis interfere with the ultrasound. It gives a lot of shadow. That's why you cannot see the details of the prostate gland. But you can assume that prostate gland is enlarged or not. If it is enlarged, then you will see it could be BPH or it could be malignancy. So then do the rectal examination. So along with the blood test. What is the blood test? PSA, prostatic specific antigen. PSA test. Usually the value is 4 to 10. 4 to 10 nanograms. 4 to 10
is normal, right?
Yeah, 4 to 10 nanogram, I think. Yeah, we'll check. And but if it is increased, it's not necessarily that patient has a cancer. No. Sometimes prostatitis, prostatism, even the massage or any touch, trauma can cause increase of PSA. PSA stands for prostatic specific antigen. That means this antigen is chemical, so only produced by the prostate gland. Sometimes they found that even though there's a cancer, the PSA is still normal. Okay, so it is not very specific for the prostate malignancy. But along with other findings, symptom, signs, sonographic appearance, then you can say, yeah, it is. But still they will do the biopsy. So nowadays, before they used to do the lot of treatment, like those who had testosterone is high because of the testicles. They cut the testicles out. They took the testicles out. Orchiectomy was the treatment. Still they can do if somebody's testosterone level is high, because they found that testosterone, the patient has a malignancy in the prostate gland, their testosterone is very high. And the testosterone is coming from the Leydig cell. Where is the Leydig cell? In the testicles. So that's why they remove one testicles. Or they were given the medicine which is anti-testosterone. Sometimes they put a microchips that has a radiation. Locally it is radiating, but generalized it is not radiation. Okay, so locally radiate and locally they kill the cancer cells. So that's the way it was. Then what are the scope of ultrasound use in prostate gland? Number one, somebody has a BPH, follow up. Follow up what is the size? Size is getting bigger. And usually the prostate gland, write down. Prostate gland, the volume is very important. The doctor goes by the volume. Usually 15 to 25 cc, cubic centimeter, or grams. 15 to 25 is a normal. But when it is 30 and above, definitely you can consider this is a BPH, benign prostatic hyperplasia. Okay, so they go by the volume. So in order to get the volume, you have to get the length and height in sagittal view and the width in transverse view. You have to multiply length times height times width divided by 2. That will give you the volume. Okay, so the scope of ultrasound is follow up. Somebody is getting the surgery or giving the treatment to shrink the prostate gland, they need to do again follow up. And somebody needs to do the ultrasound, biopsy, ultrasound guided biopsy. Somebody wants to put the chips, microchips, radiation chips, ultrasound guided biopsy. Okay, so ultrasound use is everywhere, and with the color Doppler you can see if it is a malignant, so then hypervascular at that area. At that area you will see it is heterogeneous, hypoechoic, irregular border, hypervascularity, calcifications, necrosis. So all you can check it up by ultrasonography. Okay, so that's all for the prostate gland. And they will ask questions that prostate gland, how it is affecting man's normal life. The major problem is retention of urine. And retention of urine, hydronephrosis, hydroureter, chronic cystitis, diverticulosis of the bladder, and patient has miserable life. Either patient will have polycatheter or do the surgery. Okay, and it is one of the number one man's disease causing botheration in life. Okay, so that is done for the prostate gland. Okay, thank you so much, and I hope you're gonna enjoy it. Okay, I will upload in the YouTube. Okay, thank you. Bye.